Face masks have become the enduring image of the Wuhan coronavirus outbreak, even though they aren't always the most effective form of protection. Still, factories are working overtime to make them, stores are selling out, and lines to buy them are stretching around the block. Some designers and social media influencers are even turning them into a fashion statement. In this episode, we look behind the mask for answers and discover why people are buying them, despite evidence they may not work. Supply simply can't keep up with demand. As the Wuhan strain of the coronavirus continues its march across the globe, so too does the rush for masks. There's no vaccine yet to prevent the spread from person to person, and many think that by wearing a mask they will be protected. But a mask is unlikely to be your best defense, offering instead a false sense of security.
Small infectious droplets cannot be filtered by the surgical mask. At the same time, the respirator and the surgical mask do not have the function to kill the virus. So when virus-carrying droplets sit on the surface of the mask and the respirators, they can survive the minimum few hours to a week.
That means wearing a mask with virus particles on it for too long could actually put you and others at risk. Advice from the World Health Organization does not even include the wearing of masks. It instead prioritizes washing your hands, not touching your face with unwashed hands, and avoiding at-risk areas. Simple surgical masks are designed for medical professionals. They're typically more useful for people who are already sick to prevent them from spreading an infection to others. They can keep out large droplets but not small virus particles. They're also loose-fitting with gaps around the nose, mouth and chin. More robust N95 or N99 respirator masks can be more effective at keeping out viruses, but that's only if they're individually fitted to form a tight seal. Still, masks of all varieties have been flying off the shelves in cities worldwide, like here in New York, where many pharmacies in Chinatown have run dry.
我至少去了10几个了吧，数不清了。这所有的大大小小的西药房我全去过，包括这个下东城、中城还有上城那些，我都有去过，很多都没有了。这个价钱呢，以前差不多1-20块可以买到，现在今天买49块。
一定要带那一种，因为带那一种没有用的。我有跟他说啊，他们说不好看。我知道这个不好看了，他说他知道不好看，但是男人呢都是这种，我老公也是带这种出去，不会带这个，因为这个不防的。
Large mask manufacturers like 3M have cranked up production, but it hasn't been enough to prevent a hike in prices or even the sale of counterfeit masks on the streets and online. For some buyers, the masks are about making a statement too. Social media influencers in Asia have been keen to combine style with health concern, while brands offering handmade, designer or stylized masks are also reporting an upturn in sales. Hannah and Tony Martinez make clothing for the rave and festival scene, but it's their masks that have been doing particularly well.
So since the outbreak of the coronavirus, we've seen a large increase in the demand for our masks, especially to areas that are more densely populated and to international countries. By the end of January, we shipped around triple the amount we normally do.
Designed more as a large particle filter, these masks are selling fast. At his lab in Canada, Professor Choi believes he has developed a mask coated with salt crystals that can not only trap virus particles, but deactivate them entirely.
I believe virus deactivating filters can be a critical component of a rapid response to the control and prevention of the respiratory disease during an epidemic and a pandemic.
Mask or no mask, the new coronavirus has spread quickly across the globe, already overtaking the number of recorded cases of SARS back in 2003. Joining me to talk about the impact is Arya Bendix, who has been reporting on this issue. So Arya, we've seen how the coronavirus has been ranked now alongside Zika and SARS and Ebola. So is it as deadly?
So it's important to point out that there's a lot we still don't know about this particular virus. If we're comparing it to an outbreak like SARS in the early 2000s, that was far more deadly, but not as widespread as this current virus. So health experts seem to think that this is milder than SARS. If we compare it to Ebola, that had about 13,000 lives claimed from that particular virus, but it was only spread across 9 countries. So this virus, obviously, much more widespread, but fewer death count.
So now, with countries warning against travel to China, what is the likely fallout for the global economy?
So it depends on how long the virus continues to spread. We don't know how long this outbreak will last. We do know with SARS, there was about a $40 billion loss for the global economy, and economists now are predicting that this new coronavirus could have a 3 to 4 times worse impact. So that could be up to $160 billion worth of economic losses.
Now, as the virus spreads globally, what are certain countries doing to respond?
So the World Health Organization has issued a public health emergency of international concern. And the reason they made that declaration, it's very rare and reserved for extreme circumstances, but it does protect countries with weaker health systems that might not have the money or the resources to combat the virus. So it's a precautionary measure. For right now, they're not recommending the limit of trade or travel, but some countries have taken it upon themselves to either cancel or suspend flights from China into their nation. So the US, Australia, New Zealand, Japan, just to name a few.
Now, what do we know about the cases in the US? What has the CDC and the White House shared with the public?
So it's important to note the CDC has said that the risk to the public is still low. The White House has issued a coronavirus task force meant to advise the president on how to handle the outbreak. They've declared a public health emergency in the US alone, and that will essentially help restrict travel from China. So right now, anyone who is a foreigner who has been to China within the last 2 weeks will be banned from entering the US. If you're a US citizen and you've recently visited the Hubei province, which is where the virus started, in the last 2 weeks, then you could be subject to quarantine for 14 days in the US. And that 14-day period is really crucial because it's the incubation period for the virus. So that's the time during which people are contagious and could potentially spread the virus from one person to the next.
Now, there's no known vaccine for it, but is research underway?
So essentially right now there's an international race among researchers and scientists to develop a vaccine for this virus. Several biotech companies in the US have pledged to do so and received some funding. But the process of actually developing a vaccine can take many years to develop and bring to market. So right now, the research is still preliminary. We can see a clinical trial maybe within 3 months, but we don't really know how long it will take after that for it actually to be administered to people.
So the alarm isn't warranted, or?
I think it's warranted in terms of how quickly the virus is spreading, that we need to be overly cautious. I mean, the CDC is essentially preparing right now for a pandemic, but they're very, very hopeful that this never turns into one.
We'll see you next time on another episode of Business Insider Today.